Quinshon Judkins, running back from the Cleveland Browns, suffered a very horrific lower leg injury this game against the Bills this past Sunday. My name is Ryan. I'm a physical therapist. I'm going to go over what exactly kind of happened in this type of play, what anatomy was involved in this type of injury, as well as the recovery timeline for Quinshon. Quinshon had a really great rookie season, and it's fortunate that he was unable to finish off the season with the Browns. It was later confirmed that on this play here, he did suffer a dislocated ankle and fractured fibula, which is going to be a season-ending injury and require immediate surgery. But let's break down this type of play and how this kind of injury does happen. So the broadcasting did not give us too many great angles of this injury here, so it's very hard to tell exactly how this injury happened. We can only go off of previous history of similar injuries. So if we take a look at Quinshon Judkins' right lower extremity here, you see there's an excessive amount of laxity, especially around that right knee joint. So I think there was a lot of assumption that there was multi-ligament tear in the knee joint, as well as potential fracture of the fibula. However, it was later came out that he actually dislocated his right ankle, as well as fractured that lower portion of that fibula. So if we kind of go back to the play of when the injury did happen, you kind of see the right leg kind of stuck underneath his body here. This is probably where the injury did happen. Obviously not the best view. I'm going to be assuming that the foot is going to be in a locked position with the ankle and an excessive amount of dorsiflexion. You can see all the weight and momentum is going to be coming out towards like kind of backwards and more towards the left here. This all causes that knee to be in a very odd position when he does come to the ground, making it look like it is more of a knee injury than a foot or ankle. Review all the main bones, including the tibia seen here, fibula. This all connects to create the ankle joint with the talus seen right here, and then you have your calcaneus. And then the bones of the midfoot include your navicular bone, your cuboid, your lateral cuneiform, intermediate cuneiform, as well as your medial cuneiform bones here. So here we're going to take a look at all the ligaments that help stabilize the ankle as well as that lower leg. These are the primary stabilizers that help prevent those ankle sprains, but with a type of ankle dislocation, as well as included fibula fractured, these will also be impacted. Starting more superiorly, we do have our interosseous membrane seen between that fibula and tibia here, as well as we have our anterior inferior tibiofibular ligament. Both of these are primary stabilizers in preventing that high ankle sprain. More laterally, we do have our three primary ligaments that help prevent those lateral ankle sprain, which are very common. We have our anterior talofibular ligament seen here, your calcaneofibular ligament seen right here, as well as your posterior talofibular ligament seen right here. Then finally, probably the most rare to be injured are these medial or deltoid ligaments seen right here, connecting to that tibia and going into more of that talus and navicular bone. So what is the recovery timeline for Quinshon Judkins after this type of injury? Very important to have an understanding of the healing soft tissue, cartilage damage, any damage to that nerve or blood vessels, because that will definitely play a role in his recovery. He will definitely undergo a surgical procedure, most likely open reduction, internal fixation, where they're going to put a rod to fixate that broken bone, fibula, and ankle. This will be the beginning of his road to recovery. Typically, people are able to come back to return to sports in about 4 to 6 months, so there is a good chance that he'll be able to come back and practice sometime later in the spring, early summer. Once again, though, really hoping Quinshon Judkins a very speedy recovery. Hopefully, all his recovery does go smoothly and that he is able to return to the Cleveland Browns in the beginning of next season. Thank you so much for watching, and let me know if you do have any questions down below.